Hey, Dan from Jump Bag here, and today we're back in our acronym series, and today's acronym, SAMPLE. You got to know it for the test, you got to know it for the field, and it's part of your medical assessment. So SAMPLE, signs and symptoms, allergies, medications, past pertinent history, last oral intake, and events leading up to. So let's break it down. So signs and symptoms, your S, signs and symptoms. This is going to be what you see on the patient and what they're complaining of. Hey, sir, what's going on today? What brought 911 to your home? And then they'll tell you what they're experiencing, their symptoms. We partner with that with what we see, the signs, and we've got our S. Next is allergies. Are you allergic to any medications? We showed up to do medical care. We're going to take them possibly to the hospital where medical care is going to continue. We want to know what they're allergic to so we don't give them something that's going to put them in a whole worse situation. Next, medications. Are you currently taking any medications? This is going to help us get an idea of what medical problems they have because they're being treated for them. And also, it's going to help us to know what we can and can't give because certain medications don't partner well together and can cause issues. So if we know their medications, we know what we can and can't give and a little bit of their history, which we'll find out more in with our P, our pertinent medical history. And I'm not talking hangnail when they were 6. I'm talking about, has there been any recent trauma? Has there been any recent infections? Are you currently seeing a doctor for anything? Are you being treated for anything? Do you have a history of this ailment? This is going to give us an idea of what's going on with the patient and give us that broader picture. Next, last oral intake. This matters because it's going to affect nausea and vomiting, and also if they need surgery or certain types of scans at the hospital, when they ate last could be a major issue. Also think abdominal pain or cramping. Maybe it's something they ate. This can be pertinent positives or pertinent negatives. And last but not least, our events leading up to. What were you doing when this started? If they're sitting on the couch and they get chest pain, that's a bad sign. If they're running on the treadmill and they get chest pain, maybe this was exercise induced. So knowing what they were doing when it started can give us an index of suspicion to what we think might be going on. So sample history, part of your medical assessment. If this video helped you out in any way, give us a like, and thanks for